Welcome to Surgical Assistant 101. At Moorhead State's Veterinary Technology program, the day before surgery is spent doing prep work. Along with thoroughly cleaning the OR and prep areas, this time is spent setting out and preparing the items needed for surgery the next day. Using your surgery checklist as reference, be sure to not only set out gowns, gloves, caps, and booties for the surgical team, but also to prepare the items needed for the OR. These items include, but are not necessarily limited to, a patient drape, table drape, 4-pack of towels, surgical instrument pack, surgical light handle, suture packs of varying sizes, and a scalpel blade of the appropriate size. With these items prepared, we are ready for the day of surgery. At the start of the morning, the anesthetist is the one initially responsible for the patient. Once the anesthetist has given the patient their preoperative medications and placed a catheter, they may give you the go-ahead to start prepping your surgical site based on patient cooperation. While some patients may need to be fully induced before shaving and prepping can be done, other patients, such as the one featured in this video, may allow you to do all of the shaving and prepping with only preoperative medications on board. The next step in preparing this patient for surgery is induction of anesthesia. Once the anesthetist has fully induced anesthesia and placed an endotracheal tube, the circulating assistant will do the initial scrub for surgery. At this point in time, it is now the surgical assistant's responsibility to prepare to enter the OR. First step in doing so is to remember to sterilely open your personal gown and gloves that will be needed after hand scrubbing. From this point on, it is of high importance to remember to do everything with proper sterile technique, and never be embarrassed to maintain an honest surgical conscience. Once your gown and sterile gloves are open, and your cap and booties are on your person, it is time to start washing hands. A worthwhile note to make here is that hand scrubbing is truly vital in maintaining sterile procedure. While it may be tempting to skip steps or trim off time, it is always best practice to stick to the proper protocol of scrub, rinse, scrub, scrub, rinse. As you reach the end of hand scrubbing, it is now time to head back over to the table to be dressed for surgery. The first step to this is using appropriate technique in drying hands using the towel included in the gown pack. Once your hands are thoroughly dry, move on to the step of gowning. Keeping in mind that your hands are now clean, use appropriate technique to put the gown onto your person. Placing one arm carefully in after another, being careful to not put your hands through the cuffs, and then allowing your circulating technician to tie you into the gown. The next step in preparing for the OR is closed gloving. Considering that this may be one of the most vital parts of maintaining sterile technique, it is important to be careful and conscientious during this process, even if you may not be the most graceful at gloving. As you are now considered sterile personnel, it is important to now place yourself in a place where your sterility will not be compromised. It is at this point in the surgical process that the anesthetist and assisting technicians will bring the patient into the OR. Before the surgical process can move any further, they will ensure that the patient is secured to the table and successfully and safely connected to the anesthetic machines in the OR room. Once the patient is successfully secured onto the table and you have confirmation that your surgeon is scrubbing in, it is appropriate to start sterilely preparing your instrument table. As long as proper sterile technique is used, this can be done with the assistance of your circulating technician. Simply make sure that any parts they touch hang below the surface of the table. Now that the sterile instrument table cover is in place, you may now sterilely receive the instrument pack from the circulating technician. After transferring the pack to the table, the first step is to open the pack and confirm sterility using the OK strip placed inside the pack during the wrapping procedure. After confirming sterility, you may now begin to arrange the instruments in a manner of your choosing, all the while keeping a running tally of the instrument number in your head so that you are able to give the anesthetist an accurate number of instruments at the beginning of surgery. This is an important step in making sure no instrument is left in the patient post-operatively. At this point, you will also confirm the amount of gauze included in your pack for the same intention and purpose as counting the instruments. At this point in time, you can also take a moment to attach your scalpel blade to your scalpel handle. This will avoid having to pause to do this later. Before the surgical process can go any further, the circulating assistant will perform a sterile last scrub to ensure the surgical incision site is as clean as possible. The next step in preparing the patient for surgery is the 4-towel drape. At this time, it is very important to stay conscious of your sterility and to not come into contact with the patient at any point. Keeping in mind the techniques taught in surgical nursing class, Appropriately fold and place each towel in the correct sequence of closest to you, farthest from you, cranial, and finally, caudal. It is at this time that your anesthetist team will be placing their last pieces of monitoring equipment and making sure the patient is prepared to head into surgery. Once the towel clamps are appropriately in place, the surgeon will assist in placing the patient drape. After a window incision has been made in the patient drape, you are ready to start the surgical procedure. From this point on in the procedure, the surgical assistant has one main responsibility: to appropriately identify each instrument as they are requested and correctly pass instruments back and forth from yourself to the surgeon. Depending on surgical procedure and surgeon preference, the surgical assistant may also be asked to hold instruments while they are attached to tissues in the body, or to trim the tail ends of sutures with surgical scissors when appropriate. At the end of surgery, it is the surgical assistant's duty to do another instrument count and gauze count before the surgeon has completed their suture line. The numbers gathered at that time will be compared to the initial counts given to the anesthetist to double check that no foreign object will be left in the patient's body after recovery from anesthesia. When the final instrument and gauze counts have been confirmed and the surgeon has completed their closure, the anesthetist team will begin the process of recovering the patient from anesthesia. While the patient is recovering, it is the surgical assistant's responsibility to do the following tasks: cleaning the prep tables used outside of the OR, cleaning the OR itself to return it to a decent state for the next surgical team, along with thoroughly cleaning each instrument and laying them out to dry, effectively preparing them to be repackaged at a later time. As a surgical assistant, your final duty is to ensure the proper recovery of your patient. It will be expected that the surgical assistant visits the patient the next morning to assess their overall state of being, inspect the incision site for signs of infection and dehiscence, and ensure their patient is on their way to a healthy and happy recovery.